Good afternoon, everyone. Welcome to our Facebook Live session today. My name is Dr. Angela Sue, and I'm a board-certified internist and geriatrician practicing at Kaiser Permanente in Northern Virginia. I'm joined today by some wonderful colleagues, Dr. Jolly, Brandt, Hernandez, and Menezes, who will be talking to you today about life care planning. So we know that these conversations can be difficult, but they are a really important tool to have when you're planning the future in terms of your medical care for you and your family. So life care planning is really for everyone. And today we're lucky enough to have some top doctors from a variety of specialties to discuss how to prepare for these conversations and what they're all about. So let's begin by having our panelists introduce themselves. Dr. Jolly, do you want to start?
Sure. I'm Josh Jolly. I'm a pulmonologist in the Northern Virginia service area. I am also internal medicine and critical care trained.
Dr. Brandt? Oh, you're muted, I think.
Hi, I'm Gretchen Brandt. I'm a nephrologist here at Capitol Hill Kaiser. And I'm also, like Dr. Jolly, trained in primary care with internal medicine and specialized in the kidney. So I look forward to our conversation today. Thanks for joining.
Wonderful. And Dr. Hernandez?
So glad to be here. I am an internist and geriatrician. I work in the memory care program here at Kaiser. I'm also an internist in primary care as well.
Wonderful. And Dr. Menezes?
Hi, good afternoon, everyone. I'm Jonathan Menezes. I'm both certified in family medicine and geriatric medicine, and happy to be here today to have this important discussion.
Great. So some great representation here across the spectrum of medical providers. We are really looking forward to your questions. So if you're watching live, please post them in the comments on Facebook, and we'll try to answer as many of them as we can during our session today. But in the meantime, I guess let's go ahead and dive in. So to kick us off, probably a good idea to talk about some basics. And so Dr. Menezes, I was hoping you could start us off by kind of explaining what do we really mean when we're talking about life care planning? What is it, and what should we be thinking about?
Thanks, Angela. So, there are a lot of terms that are thrown about, and it's a good idea to start with the basics. So we have some, definitions in mind, so that helps to frame our conversation today. Here at Kaiser Permanente, advanced care planning is something that we call life care planning. It's the same thing. The first thing to keep in mind is let's define what an advanced healthcare directive is. So it's a legal document which writes down your preferences for medical care in the event that you cannot make your own decisions. There are three real pieces that go into an advanced healthcare directive. The first piece is designating a healthcare agent. This is someone who can voice your healthcare choices in the event that you cannot communicate. In the unfortunate event, if you're in an ICU setting or if you have a stroke and you're unable to communicate, this is the person who would give your choices, your preferences for treatment to your healthcare team. A healthcare agent is sometimes called a healthcare proxy, also called a durable power of attorney for healthcare, or a medical durable power of attorney. Lots of terms, but they're essentially the same thing. So it's important that you communicate these wishes to your healthcare agent in the event that you cannot make those healthcare choices for yourself. So that's the first part. You need a healthcare agent. The second piece is actually documenting specific preferences for healthcare in the event of a sudden injury or illness. This includes choices regarding life-sustaining treatments, things like, do you want to be kept alive on a ventilator or a breathing machine? Would you be interested in going through a dialysis? And I know Dr. Brandt may give us some insight about that, things regarding artificial nutrition, a feeding tube, for example. A second piece with this would involve whether you would want to be resuscitated if your heart stopped. Commonly called CPR, cardiopulmonary resuscitation. It involves chest compressions, sometimes medication, sometimes using a breathing tube to help sustain your life functions. When it comes to your preferences regarding these life-sustaining treatments, You can opt for being a full code where all these measures are put into place in case they are ever needed, or you can opt for something called a DNR, which is do not resuscitate. If you make those choices, you communicate them to your primary care doctor, who can sign a form, which is kept on your medical record. It's called a DNR form, or a POLST or MOLST, physician orders for life-sustaining treatment. So this is kept in your medical record for your medical team to know, and also you keep a copy with you at home in case the need arises when an emergency crew comes to your home or something like that. So those are the first two really main pieces of the Advanced Healthcare Directive. And the third piece would be where you just write down what your choices are, what are your beliefs, what are your views, what are your hopes and dreams, and all of this together encompasses an Advanced Healthcare Directive. So I hope that answers the question. It's a lot of information, but it's good to get started off with the basics.
Yeah, thank you so much, Dr. Menezes. So definitely common language is important, so we understand what we're all talking about today when we're saying advanced directives. And I think, to me, it sounds a little bit overwhelming, I'm sure, to some of the Facebook audience as well. So there's a lot of terms, but hopefully we'll kind of help clarify that and help you understand, why it's important to do this process, and also how to facilitate that as much as possible. So I guess, this is a lot of planning, this is a lot of thinking about difficult situations, but maybe Dr. Brandt, can you tell us a little bit, like, from your perspective, why is it important to have an advanced directive?
Well, that's a great question, Dr. Su. And it really is important because nobody can read your mind. I think that's really important to remember. And so even though you may have really great relationships with your spouse, with your children, with your family members, they may not necessarily know what you're thinking in terms of your medical care. So one of the things that this document does is it just helps us to put down on paper. Maybe you've even had some conversations with your family, but it just helps to put it in a more formalized format so that, should something happen, then we all can understand what your wishes and desires are. And so I know sometimes for patients, for example, they may be, let's take an elderly patient whose wife is also with some medical challenges as well. Mm-hmm. And that individual patient might want their daughter, who's a nurse at a local hospital, to be their, what we call healthcare agent or power of attorney, the person to make decisions. So if that isn't put in writing, then it's not easy for that to necessarily be known by the healthcare team taking care of the patient if something happens. And so naturally, they then go to the wife, who may be elderly and not able to answer the questions and be a little bit overwhelmed. And oftentimes, I don't want to scare anyone. It gets worked out in the system. We figure out like who's the person that's needed to make decisions. But unless it's clarified ahead of time, it can be a little bit tricky to figure out at a moment when it's more important to know it.
Absolutely. So we never know what's going to happen. As Dr. Brandt said, it's good to, think about these things and have discussions with your family about them. And, I guess the question is, when do we start thinking about advanced directives? At what point should someone do the advanced directives? Dr. Hernandez, you see patients in primary care and as a memory specialist. What do you usually recommend about when patients should start thinking about advanced directives and as part of their medical care?
Thank you so much for the question, and a very, very important question. And again, thank you for my colleagues who already laid the foundation about this very important topic. So I'm excited to talk about this. And so I say that any adult patient of mine can fill out their advanced directives, but really the focus on those who are seriously ill with multiple medical issues, recent hospitalization, who's frail, and that's who I really try to focus on having these conversations. But really any adult can have this, and I've had this conversation on younger adults who just had a question about like, hey, I'm young, am I healthy? But what if something happens before, some who are planning elective procedures, and they say like, hey, if anything happens, I want to have a plan for myself. So when to consider this conversation is very important. And we typically think about when to visit this is the 5 Ds. So one is the every decade of life, okay? Another D is death of a family member. Another one is divorce. Someone divorces, a diagnosis, whether it be a new diagnosis of cancer, diabetes, a pulmonary issue like asthma or COPD, kidney issues like going on dialysis. Very important to have these conversations at this time because as the disease progresses, things do change. And then the last one, this is very important, is a decline in health. So if someone is having more medical issues, they're declining in their functional status. I give an example of, my own mother. I've had conversations, and she, had diabetes, and she developed stage 5 kidney disease and was on dialysis. And I've actually had conversations with her on multiple occasions after each stage in her health. When she was fine as a diabetic, very, very vibrant and functioning well. And then, towards the later stages when she went on dialysis and developed dementia, had these conversations with not only her, but also my other family members. And so another nugget that I want to kind of place with this, and that sometimes when we're having these conversations, it's just not like a one-on-one. And sometimes with different cultures, it should actually be with your family in discussing this. And I think that's very important and powerful, because oftentimes this is a lot of times a family decision. And it's often very important to have these early on. And the last thing is that, let's say whoever, is on this Facebook, hey, I'm healthy, I have no medical issues, I don't have a lot going on, but do you have a family member who is older and maybe frail with multiple medical issues? And maybe you can identify someone in a loved one who needs to have this conversation to get that started. So.
Those are really good points, Dr. Hernandez. Thank you so much. I mean, it sounds like most of us should have some advanced directives at this point, even if we're, not at the end of life or particularly ill. I think of it kind of like almost like how we approach financial planning. A lot of us have life insurance policies. A lot of us have done some sort of will for your assets, but what about for your medical care? I think these are all really sensible and helpful things to be doing in terms of planning ahead for your family as we move through life. And, as Dr. Hernandez said, definitely revisiting the situation as your health status changes, as your family situation changes, to make sure everything's still up to date. You can just imagine how many changes happen throughout one's life to kind of make it so there might be changes in what it is you want for your own care. I think that, because of how heavy this can be, for a lot of people, it doesn't really seem to be on the top of the list. But I think it's really, we've seen a lot of cases in our own clinics and the hospital, I'm sure, that have kind of illustrated how important this is. I don't want to be telling cautionary tales, but I know Dr. Jolly and Dr. Brandt probably see a lot of patients in the hospital. And I'm wondering if you guys have any clinical experiences in that setting that kind of have illustrated to you some of the pitfalls of not having an advanced directive done that have affected how your patients are cared for.
Yeah. So like you said, right, I see kind of the outpatient setting, but also in the hospital, how important it is to have these filled out. So I can think back, just to last month when I was rounding, and I had a patient who's had progressive dementia to the point where she no longer could swallow safely. And unfortunately, she was still eating, and a lot of the food, drinks, whatever she was taking in was ending up in her lungs and causing recurrent pneumonias to the point where she was on a lot of oxygen and confused and no longer could make medical decisions for herself. She only had one family member, a son, who came to the hospital and spent a lot of time with her. But unfortunately, he told me he never had these conversations with his mother, and he didn't know, what she would want in a situation like this. Unfortunately, she was very sick, and the conversation about being put on a ventilator was something that we had to have. Ultimately, we helped her son through some of these difficult conversations, and he was able to make some decisions for his mother. But I saw on, you know, the son's side, struggling to try to figure out what his mother would have wanted, but also balancing kind of this really difficult decision, you know, or difficult decisions that he was being asked to make. So it was a situation where, you know, had an advance directive been filled out, he would have been kind of in a place to follow his mother's wishes instead of left trying to guess, you know, what she would have wanted in that situation.
And Dr. Jolly, you raised an excellent point. You know, I regularly see patients in the ICU intensive care unit, and they are with the breathing machine, so they can't communicate, and they're on dialysis, which is my specialty, or they're being considered for initiating or starting up with dialysis because they're very sick. And as you say, sometimes, many times, there are not advanced directives on the chart. So I think it's really helpful because actually it's, as you point out, it helps the healthcare team know, the physicians and nurses and folks taking care of the loved one, what their wishes really were. And it's helpful when the family can articulate things, but sometimes the conversations in advance are really helpful. And the other thing I want to point out that it's helpful in doing is it helps us as your physician to really get to know who you are and what your desires are and what your wishes are. So for example, this morning, one of my dialysis patients told me when I asked him if he had anything on his bucket list or something he wanted to complete, he said, you know, I still want to keep, you know, I want to go to the Caribbean on a cruise this winter. And so I was able to hook him up with the social worker. But he said, I want to keep doing things around the house. He's a retired electrician, so he'd like to consider working part-time again. He started dialysis within the last half year. So he's, you know, thinking ahead of these things. But, you know, I was able to tell him that I think first that his life expectancy is several years, encourage him to get transplanted eligible, but also to remind him that to fill out the life care planning, because even though he's told me verbally that his wife is the one that will make decisions and that he would want to be a full code. So in other words, he would want to have his heart shocked and he would want to be on the breathing machine if something happens suddenly. It'd be nice if he put that on paper. The other thing is too, that when the nice thing about Kaiser is an integrated system, right? So we talk to each other a lot. Sometimes we talk to each other more via texting, you're hearing text going off, or via email, but we're able to communicate with other physicians and team members. So it's not infrequently that I get a text or an email from one of the palliative care physicians or one of the hospital doctors or one of the pulmonary doctors saying, hey, Dr. Brandt, what has been going on with your patient? Can you tell me more? I see you put a note on this day. So it just helps you as the patient get better care.
That's such a great point, Dr. Brandt. I mean, because really advanced directives or understanding what the goals of care are, not just for the end of life, as you said, right? It has to do with what are your priorities with your health. And the advanced directives might be documenting a very small portion of that, but they're also giving the opportunity to think about what is really important in your life and your medical care, and, you know, understanding those, make sure your family is on the same page to kind of relieve some of the stress in a really difficult medical situation if that were to occur, even if we can't avoid all medical challenges. Those are all such great examples. So of course, not everyone's situation will be the same, but I think that what we're trying to drive home today is that, you know, advanced directives really provide kind of a measure of control and understanding for you and your family to be able to face what's ahead together. So, you know, Dr. Menezes, how would you recommend your patients get started with their own advanced directives if they're interested in doing so?
Yeah, great points, everyone. And yeah, at the outset, I would, you know, reiterate that this is not a comfortable conversation or discussion to have, right? There's so many other priorities, but we have to make this important. We have to put in the time to get our wishes, our preferences, our choices on paper, so that our families, our loved ones are they have the peace of mind knowing that they're respecting your wishes should the time come when they have to make that decision for you. So the way I look at it, to, you know, start off this conversation, it's a lot of, it's, you know, for our Facebook audience, it's so much of definitions and there's so many pieces that you have to go through, and it can seem a daunting task. The way I like to encourage my patients to start off with is to just take a step back and maybe just think about what matters most to you. on a good day, what would you be doing? What would a good day look like for you? Would that, what's important? Is it my family? Is it being a spouse, a parent, a sibling, working, my hobbies? Once you have that kind of information and you've gone through those questions, another question to think about is, we all know a coworker, a loved one, a family member who may have been in a similar situation where they were at the end of life and may not have had an advance directive, may have had one, may have seen things like life-sustaining procedures that were put in place for that loved one. How did that experience go? What does that make sense to your specific choices? And once you've gone through those couple of questions, the next step would be to think, who would you trust to make those decisions for you in the event that you can't communicate with your healthcare team? Think about someone who's easily accessible, who's close by. Think about someone who knows you well. That person doesn't necessarily need to know a lot of medical information, but they need to be able to articulate your wishes in a situation where you can't do that for yourself. And perhaps even someone who's able to make sometimes difficult decisions in a stressful environment. So that's the way I look at it. Just start somewhere. There's no time like the present to plan for your future. Start somewhere, start writing down your thoughts on paper, and then come up with a person who you trust, who can be your voice when you can't speak for yourself.
It's great advice, Dr. Menezes. So choosing a healthcare proxy is important, of course, but then being able to communicate all this information to that person is also really important. And as we said, really difficult conversation for a lot of patients and their families to have. Dr. Hernandez, do you have any tips for how people can start this conversation with their loved ones or their healthcare agents, and what should they be talking about?
Absolutely. I think, not only just choosing, who you want to be your healthcare proxy, but how do you communicate this? And one of these nuggets that I got from a website that I'll share for you called the Conversation Project is, we can't plan for everything, but we can talk about what's most important in our life and in our healthcare with those who matter the most. And I just want to, and that's a huge thing that I feel like is so important. I actually, for myself, when I was early on this process, getting to know more about advanced, care directives, and my mother had, her own illnesses and her decline, I actually decided to take a course through Kaiser. It's actually an online course, which anybody who's on the Facebook Live event that you actually can book online, just to educate yourself more about advanced care planning. And one of the things that I just want to give the perspective of this is that this is a gift. This is a gift that you can give to your family members so that they have peace of mind that if anything were to happen to you, that they are respecting your wishes. And so one of the it was basically a group meeting. There's only like 2 or 3 of us, but he had mentioned that his loved one, his wife, had passed away, and she didn't have any of this. She didn't have any advanced care directives, and it was very chaotic towards the end stages of her illness. And then he said, and the reason why he entered this class is that I don't want this for my children. I want my children to know what I want if I become very ill. And so one perspective I want to give first and foremost, that this is a gift to your family members. Okay. Number 2 is like, how do you communicate? Is it trying to normalize? Just as you mentioned, Dr. Su, about, just a financial check-in. Think about this as a medical check-in. Okay. And try to normalizing this conversation. Okay. And we do not have to have this conversation all in one big setting. Many people think that we need to have this, a 1 or 2 hour conversation. No, sometimes this can be a, maybe a 5 or 10 minute conversation after dinner, and then having, small conversations over time. And so there's really 3 steps, to communicating. Is number 1, and what Dr. Menendez was talking about, is the first step is think about what matters the most. Okay. I think that's, very, very important. And that is to what he was, mentioning about what matters to you most. If I were having a good day, I'll be doing this. If life would no longer be living if I was not doing, if I could not do X, Y, and Z, if I could not eat, as Dr. Jolly had mentioned about the end stage dementia patient who was, aspirating, right? Because at the end of the day is that it's important to have what we call, and this is the holy grail when we're looking at palliative care and respecting wishes, is to have goal concordant care. That whatever we want to provide you the health care that you want. And the way you communicate this is through the advanced care directives, okay? And so one of them is the perspective, again, as a gift. Number two is normalizing the conversation. And the process, the first process is thinking about, what matters. Number two is planning your talk. And when you're having your talk, small conversations are often more fruitful than just one large conversation. The one thing I wanted to mention about planning your talk is that it is who do you want to have in your talk? And when you're thinking about that, is that looking at if you had an illness, who supports you during those difficult times? Now, typically it is your close family and friends, but hey, it could be someone who's a part of your faith and your culture that may not be one of a relative. And so I think it is supportive not to only have your family members, but also the other support, whether it be our church members, our very close friends who are like family members, to be a part of this conversation. So number two, again, is thinking about what matters to you most. And the second one is planning your talk. And number three is start talking and having this conversation. Again, not on all big chunks, but small chunks, and having for a follow-up after these. And so the one thing I would say is very important. So once you have this conversation, you jot down some ideas, and especially on this document, the advanced care planning document, you want to make sure three things. One is that you yourself have a copy. Okay. Number two is that you give a copy to your loved ones and you have this conversation, with. And number three, most important, you're sharing this with us, okay, with your healthcare professionals. And that is handing it into your healthcare provider. In many centers, they have a medical records, and then so that this can get uploaded in your chart.
Great, Dr. Hernandez. Thank you so much. Dr. Brandt, I'm sure you're having these conversations all the time, as you alluded to. Are there resources or tools that you usually recommend for your patients to kind of help them through the process?
Sure. And, I just wanted to also comment that, as listeners to today's Facebook and also as our patients, we are not asking that your healthcare agent or the person that makes decisions, if you're not able to make decisions, is the be all end all. We as a healthcare team come to you with information about what we think are good ideas and what we think are good medical things to pursue. It's just that when there's someone on the other side who can represent you and your belief systems and your culture and so forth, it's incredibly refreshing and helpful. So if I have time at the end, remind me to share a story that exemplifies that. But to Dr. Su's question, yes, we have a lot of resources online, kp.org/life care planning. And so you can go on there and you can download the booklet. I tell my patients not to get intimidated by the booklet when I give it to them, because literally in 30 seconds, most of them are able to tell me who can make decisions for them if they're not able to, what their phone number is 50% of the time. And then also, if they want to have their heart shocked in the breathing machine, at least a lot of folks will say initially until things are sorted out. And that's actually part of the documents that you complete, the life care planning booklet that's available online. Also, Kaiser offers classes that are free. You can sign up for those, happen periodically. And then also we have experts in this, social workers and palliative care physicians who've walked this walk before and have more tools in the toolbox to help you sort through in case, for example, you have a particularly complex situation where you're caring for a loved one at home full time. It's really helpful because sometimes even in my discussions with patients, I realize that they are able to get more resources to their loved one. The patient is able to access more resources than what they're currently getting. So it's just good to have these conversations. Lots of resources. I would say if you're intimidated by the computer, which I guess if you're on Facebook, you're not, if you're like me, a Facebook junkie. But if you're intimidated, or if you have family or friends who are intimidated, tell them to simply talk to the doctor that they feel the most connection with. Typically, that's going to be the primary care doctor, but sometimes, like Dr. Jolly may have an end-stage lung patient that you feel connected to the lung doctor or the geriatrician, whoever you feel connected to. Start the conversation there. Hey, I listened to Facebook Live. I have a family. Just jump. You don't have to have everything lined up and ready to roll.
Great. So yes, online resources, they're all the time, but your medical team is definitely a great resource for you as well. I think as doctors, we have a lot of things we're trying to take care of when we see each and every one of our patients. And so maybe even for us, this might fall off the to-do list for that visit. But this is something that absolutely you should bring up to your doctors anytime, and we can always help guide you through it. So I guess we've gone kind of the scary no advance directives. Dr. Jolly, Dr. Brandt, it sounded like you had some examples too of when advanced directives are really helpful. Like how do you guys use the advanced directives in the hospital setting, or in a critically ill setting? And are there examples where the advanced directives really made a big difference for the patient and the medical care they were receiving?
Yeah, thanks, Dr. Sue. So you're absolutely right. Like typically when I'm getting involved with patients in the hospital, it's because they're really sick. They're in respiratory distress. They're requiring super therapeutic amounts of oxygen. A lot of times their condition is life-threatening. And so it can be really scary. It can be really challenging. I think back to, if I can give you another example, a patient that I actually had almost 2 years ago. I still remember, lovely man, lovely family, got to know them pretty well. In the outpatient setting, he had a combined lung condition where he had really bad fibrosis in his lungs, but also really bad COPD, and was on oxygen. And he knew after our conversations that his condition was end stage. Something that he hadn't known prior to our conversations. And so unfortunately he got sick and was hospitalized and was on high amounts of oxygen. While I was seeing him in the office prior to the hospitalization, I broached some of these tough conversations and ended up giving him a life care planning booklet and answered as many questions as I could for him. And he went home and he had some tough conversations with his family members, but he made sure that they knew what he wanted. And unfortunately, when he was hospitalized, he no longer was in the mental state to be able to make some of those decisions for himself. And I remember his family, when I walked into the room, tears of joy, because they were able to express that they knew exactly what he would have wanted in this really tough situation. And so they followed his wishes. So example of how it can turn out good.
So hard, but able to make that difficult situation a little bit easier, just having made those decisions in advance.
And Dr. Jolly, I like how you pointed out that the patient's family was able to stand by his wishes, because I think sometimes it can be very difficult when you're the daughter, the son, the spouse, what the wishes are. And a lot of patients also, when you talk with them, they prefer to die at home, but a lot of times they end up dying in the hospital. Sometimes there are patients who prefer to die in the hospital. They may have a loved one that's they're caring for, and they know that person and they don't have other family in those sorts of situations. But when you are able to articulate those things in advance, it's just incredibly helpful.
Well, that was a great discussion so far. And I actually don't think we have any questions from the Facebook audience. But we do have a few minutes, maybe just for everyone to give some closing thoughts and remarks. Anything else you want to share with everyone listening to some Facebook about advanced directives? Maybe we'll start with Dr. Menezes first.
Sure.
Anything you want to leave us up? Yeah.
Yeah, I think, thank you to all of you guys for such a great discussion. It's not an easy topic. If there's anything I would add in closing, is just to reiterate that this is a daunting task. There's lots of things, there's lots of moving pieces, pieces of information you have to fill out. But it's important to do it one step at a time and write it down on paper, because telling your doctor who your healthcare agent is, or just saying what you would want is insufficient. We need it in writing because it helps us. And it helps the entire team, because I might be seeing a patient in the clinic, and that patient gets admitted to the hospital, and he may have told me something, but that information is not available to Dr. Brandt or Dr. Jolly in the hospital. So making sure everyone's on the same page, just start somewhere, get the process going, reach out to any one of your physicians who I'm sure would be more than happy to help you through the process. And also check out the kaiserkp.org/lifecare planning webpage. It has a wealth of information that walks you through these scenarios and will answer almost every single question you have. So don't delay and start today.
Thank you. What about you, Dr. Hernandez? Anything else?
Yes, one is that, as I mentioned this, I think, to come away with this is really a gift that you can give to your family members, just like as Dr. Jolly, that very situation where advanced lung disease, and the family was able to come and support him at the as the patient's really sick, and respecting his wishes. Because at the end of the day, as I mentioned, it's really about giving the care that you want, and having what we call goal concordant care. One way, one website to take a look at is the Conversation Project, which can be helpful in just having these conversations, what questions that you can ask your family members and your loved ones. It even has different booklets on how to have these conversations if your loved one has dementia, or even those who are adults who are caring for children with serious illness, and things just to think about. So I think that's a very helpful piece. Also, too, is just being mindful that these conversations don't happen in a vacuum. There are cultural aspects to having these conversations, just respecting one's own culture and how you may approach it. Sometimes it does feel uncomfortable in having these conversations, but again, trying to I always try to normalize it. And then I was also giving back to allowing families to know, and my patients to know, that this is, again, the gift that you could be giving, this knowledge when you're really ill. And then the last one is just to really just start having that conversation, whether it's 5 minutes or 2 minutes. That's important.
Great. Dr. Jolly?
Yeah, I think my take home point really is that there's no right or wrong answer in how you go about this, right? It's starting this process. It's something that most of the time doesn't get answered in 1 minute or even a day. But just knowing that there's no right way to do this or wrong way to do this, it's how you want to do this. And making sure that your family, your healthcare team, your providers know exactly what it is that you'd want if a situation potentially was to arise, as Dr. Hernandez termed it, goal concordant care.
Absolutely. Dr. Brandt, any closing thoughts?
I would just echo the sentiment of my colleagues that, it's a gift that you're giving. It's an ongoing conversation. It doesn't have to be completed in one setting, and you can always update it. You can change it. It's meant to be goal concordant, or what you want to have for the end of your life care. And I think a good phrase to remember, if you're wanting to start these conversations with loved ones, tell me more. Tell me more about what your desires are at the end of life.
Beautiful. Thank you. And I think that, one thing that can be intimidating, you see the booklet, it's so official, you sign it, witnesses sign it. This is not set in stone, as we said, right? And we don't know what the actual future holds for any of us, but this is an opportunity for us to exercise our own independence, our autonomy, share those wishes with our medical team and our family, so that we have some basis to be doing the best that we can to take care of all of us as we move forward. So get started. If you're intimidated, you need help, reach out to your medical team at any time, and we'll be more than happy to help you take this very important step in your advanced planning. So thank you so much for tuning in to our Facebook Live. For more information like this, visit us at the Kaiser Permanente website. And I hope that you are all well and have a great day. Thank you.
Thank you. Bye.